Now I would like to commence with our today's session, which is entitled Role of Graphic Medicine in Public Health Sector. It is a pleasure for me to introduce our eminent speaker for today's session, Ms. Nisha Kalayil ma'am. Ms. Nisha Kalayil ma'am is currently a assistant professor of pharmaceutics in St. John Institute of Pharmacy and Research. She has 5 years of teaching and 1 year of industrial experience. Ms. Nisha ma'am has been active in teaching and research throughout her career. Her research areas include development of nanocarriers like microsponges, microspheres, and cosmetic formulation involving herbal extract. In the industrial stream, she has worked as Regulatory Affairs Officer. Ma'am is currently pursuing a PhD and has completed her MPharm in 2017 from Kerala University of Health Sciences, Kerala, and has been active in various programs by forums like IPA, University Youth Festival, and AICTE. With this brief introduction, now I would request ma'am to take over the session.
I believe I am audible. I'll start my session. Good afternoon, everyone. All right. So I am here to present a very small topic on the role of graphic medicine in the public health sector. As the name seems a little bit boring, but the topic is not boring. All right. We will try to include all the comic version of it. That is what a graphic medicine means. All right. So the contents include what is a graphic medicine. It is not something which you usually learn or read in a book. It is something which you come across in a comic book. It was a term coined by Ian Williams. What are the roles of it? Benefits, visual altering the text, using graphic stories in teaching and patient care. And the next steps, the sixth point, which is the next step, is included because this is a topic which is still in process. It's like a developing. And the seventh point is conclusion. So let's start with what is graphic medicine. The graphic medicine connotes use of comics in medical education and patient care. So it is just simple why it is related to pharmacy. The phrase was coined by Ian Williams to denote the intersection between medium of comics and discourse of health. So as I said, it is a little bit comical, as in a graphic. All right. Here, what we do is that we use pictures to depict some of the severe illness. Comics offer an engaging, powerful, and accessible method of delivering illness and narratives. For example, when we approach with you in the classroom with a PPT presentation, the more the pictures, the more the understanding. All right. The actual purpose of including visuals in a PPT is to engage the audience, boost their understanding of your content, ignite an emotional response. Now, the same if you have ever visited an Instagram page of Mumbai Police, you will see they use a lot of memes to communicate the basic rules. All right. During the pandemic, they had started it. They use a memes from the movies and everything, which are much more louder than the sirens of police. Since Mumbai Police has entered the Instagram, they have created a separate fan base where the content created is much louder than the sirens. Now, same, I'm just giving an example before we start. Same for the, condition called as autism. We are all aware what is an autism. It is also called as Asperger's syndrome. It includes the basic social skill lacking, right? So here also a patient who is suffering from autism or the caretaker, the person who takes care of such people, visuals can help to communicate more louder than the words. This decreases frustration and may help decrease problem behaviors. So let's start. Ian Williams, as I said, he's a comic artist as well as a physician, writer who lives in Brinton. His graphic novels, the first one is Bad Doctor and the second consecutive one was The Lady Doctor. All right. Now, The Bad Doctor, his debut graphical novel, was highly commended by the British Medical Association at the Medical Book Awards in 2015. The main character, what is the storyline of the particular book, is that the author or the main character suffers from obsessive compulsive disorder. All right. As far as I'm concerned, when we say OCD or obsessive compulsive disorder, the main thing which comes in our mind is that a person who is obsessed with certain particular schedule or a cleaning. All right. If I keep one thing in a particular angle, it should stay in that angle. All right. That is one of the example of OCD. And the second book, The Lady Doctor, it is based on a experience of a lady doctor juggling both the home and a sick mother. So Ian Williams, as I said, was the person who coined the term graphic medicine. Now, these are some of the examples of graphic medicine. First one is a visual journal. It's from a kid's point of view during the COVID-19 pandemic. A visual journal of life with a young child during the COVID-19 pandemic. Second one, all right, the dying for attention is a memoir of nursing home care. The taking turns is a story from the HIV unit wards, which is there in the hospitals. Usually graphic medicine is an approach where we convert our experiences, all right, the experiences from the experts, the instruction to the caretaker or the patients in a form of comics, graphics, all right. And the last one is the cover page of a book which depicts the depression in youngsters. So you can see how much clear the picture is. Now, I think this picture you all might be very familiar with if you are a K-drama addict, all right. It was the latest Korean drama. The name was Extraordinary Attorney Woo. The main character suffered from autism, all right. It was first spectrum autism, as I said. It is also called as Asperger's syndrome, a development syndrome related to autism, characterized by awkwardness in social interaction, all right, and with a very narrow attention span. If we are speaking and the front person is giving us a zero attention, all right, it can be a little bit frustrating, but this is one of the symptoms of autism, all right. Now, in this, the character is very obsessed with whales. I think most of you might have watched it. Very obsessed with whales. So whenever the character mentions or experience such little bit of autism syndromes, the whales come across the screen in a form of graphics, in a comic way. Now, the second picture is first aid learning for the kids using a comic strip, using usually a mascot. Now, mascot is something like a character. All right, we use a character. Let's say FIFA 2022, we have a character named Libby. All right, so we use a mascot to explain the people understand our concept. So the second comic strip is based on first aid for kids. Here, wheezing is mentioned. Now, whenever we hear a wheezing word, it is the unusual breathing with a sound of whistle. All right, so what a kid should do. We are able to read it, we are able to understand a basic concept of first aid. But to make a kid or a child understand, whether it is 10, 12 or 13-year-old, to understand and to imprint in their brain, it is difficult. So we use a comic. Now, as interesting as it sounds and as simple as it sounds, because we are already on my sixth slide, as simple as it sounds, it's not that beneficial. It has certain drawbacks too. Now, graphic medicine is a growing genre that combines comics or graphic novels to capture and tell health stories. Sometimes graphic medicine refers to information materials like comics being used in patient handouts. But most often, graphic medicine are memoirs or semi-autobiographical novels. Now, graphic medicine is the use of comics to tell personal stories of illness and health. For example, there are many of the illness or like disorder. Let's not go with the term illness. Disorder which requires a lot of action rather than words, what you read in the books. The combined language of words and picture, that is the comic medium, gives you approachability and emotional impact to these personal stories and even to the clinical data they sometimes use. So now when we read, let's take an example of a news article. When we read a news article, we usually skim over all the details, right? Only the headlines. If the headlines is catchy, we will read it. But instead of the headlines, if the picture is catchy, we will also read it, okay? So now playing a valuable role, how a graphic medicine plays a valuable role, reflecting or changing cultural perceptions of medicine, relating the subject of patient care, provider, as I said, it's for patients also, care provider also, enabling discussion of difficult subjects. For example, difficult subjects, it can be of healthcare only, where we teach kids about good touch and bad touch. We usually use pictures to depict that. All right. So these are all sensitive topics which can also be dealt easily using a graphic medicine, helping other sufferers or carers. So our experience, which we record in form of a graphical medicine, can also be included in the library. I will explain. There are certain websites also which provide this service. It is a non-profitable website. Everything is free in there. So our experience can also be recorded there, and some might who need help can also refer to our experience. Now, benefits include to using comics in medicine are wide and varied. For medical professionals, graphic medicine can build empathy and help establish understanding around what it means to be a patient. Now, the word empathy usually means something related to sympathy, right? To acknowledge what the friend person is feeling, right? To feel sympathize. So when we watch a sad video or something, we are able to much more connect, usually share or react to that. The same way when we use a graphics to depict the condition, for example, Alzheimer, where usually a person even forgets everyone close to them. That is one of the symptoms. So these all things can be connected. Third benefit can be for patients and the family of patients. A well-selected graphic medicine title can help readers work through the social isolation and stigma around the sickness and disease. For example, as I said, autism. Autistic people lack the social skills. Like if I say a single word or a sentence, they have a tendency to repeat it. Right? I said be quiet. The friend person who is an autistic may repeat the same word back to me. It is not intentional. It is one of the symptoms or one of the things which come along being a autistic person. Now the third, for patients and families of patients, a well-selected graphic medicine can help readers work through the social stigma and the sickness and disease. Graphic medicine can be more accessible way to approach a complex health topic. Fifth benefit, graphic medicine can also be an asset to collections in public libraries, as I mentioned earlier. Now, what is the point of doing all these things? Now, one of the students in third year had asked me, how can I incorporate my talent of graphical, creating a graphical memory into pharmacy field? All right, this is one of the job opportunity if you are much more interested in graphics. Now, visual altering the text is that something which is there in a text, we convert it into a image. By using visuals, comics have the ability to directly immerse the reader in a specific content. Let's take an example of you all only. If we give you a dry pages with all the words and ask you to, like 10-15 pages, and ask you to read and memorize it, it would be very difficult to read and memorize it after 3 pages. All right, after 3 pages, I'm probably sure 50% of you will start yawning. Okay, because it's too much theoretical. At the same time, if you have a flow chart, if you have something specific stating the arrows and depicting the procedure, it becomes much more easy. Effectively harnessing visuals enable readers to develop a rich and layered comprehension of narratives. As I said, it is an experience, rapidly increasing the ability to connect with the scenario. The effectiveness of comics also lies in the ability of visuals to have a high recall value. Recall value as in once you have read, all right, if you have read a story, you might remember it because of its pictures. For example, the famous story of the hare and the turtle. I think everyone remembers the story because anyways, we had read it in nursery, but still we recall the story, all right? Because a lot of times it's been depicted in the cartoons, comics, and a lot of books. So it is like a recall value. Something you learn, you should not forget it. So the pictures and the visual treats help you to memorize them. Now, using graphic stories and teaching and patient care. So we have 2 points for the same, medical education and patient care. Now you have to remember this is just a graphical concept. It can never replace the original way of learning. So let's start with the first term for the using graphic stories in teaching and patient care, medical education. Although graphics texts are not widely integrated into medical education, educators in other fields have successfully used them to teach topics as diverse as professional ethics, creative writing, composition, literature, and physics. Graphic stories like film, fiction, poetry, visual art, which have already been integrated into medical curriculums, are engaging ways to enhance the medical education. For example, film, all right, a short film. Okay, usually we make a short film to understand certain basic concept, the social stigma, all right, which is related to healthcare. The third one, the use of images with text minimalized the illness experience, facilitating a greater connection with the characters. Fourth, graphic stories can also be used to teach observational skills. Now, related to patient care, the graphic stories have been used to promote public awareness and enhance patient care for various problems, including substance abuse, HIV, diabetes, and mental health. Now, from this, let's take an example of substance abuse, which is a drug abuse. So usually to create an awareness among teenagers and the other populations, we use certain pictures, all right, certain pictures depicting what happens, what is going on, what you should not do, all right. And then let's take an example of HIV. Earlier during the concept, all right, when HIV was introduced, we had a myth, all right, myth as in a belief which was not true, that it spreads via touching out. But now we are educated, we know it doesn't. But that doesn't mean all the population is aware of it. Okay, so these all things can be made in an awareness form by using a visual treat. Now, second point of patient care, the medium is particularly appropriate for educating patients, since an increasing diverse population poses challenges to effective verbal communication. All right. Research has shown how combining pictures and text enhances the understanding, as the activity of reading and viewing activate different information processing system within the brain. So obviously we have 5 senses, right? One of them is sight. So once you see something, you like it, then you are interested in it. If you have seen something extraordinary, you will remember it. So that is how our brain works, all right? The first thing we do when we walk also, we observe our sceneries, the surroundings, and then we start gaining information about them. The fourth one is graphic pathographies can also help patients and their families to understand better of what to expect of a certain disease. For example, Alzheimer's, as I said, the patient, Alzheimer's or dementia, a person will forget everyone, all right? Now, at the later stage of the disease, the person even forgets how to swallow a saliva, all right? It's a personal experience, that's why I know that. So they also forget how to swallow a saliva or a food. So you require a lot of patience, all right? If you hold a spoon with food and try to feed them, they might not open their mouth at least for 10 minutes. Think about the patience you require to take care of such persons. So that's where the graphic comics come, which help us to understand more of what to expect. So it's like if we know what is going to happen, we will at least be prepared for the scenario. Next step, integration of graphic stories into medical education and practice is not without challenge. Obviously, if we are trying to do something new, it is always a challenge. To identify appropriate graphic stories and get into the hands of those patients who are most able to benefit from them. Research can help to dispel doctors' skepticism about the use of graphic stories. Now, when we say a word comic, it sounds very easy. Cartoon hi to banana hai, right? No, it's not like that. You have to research on the particular topic. You have to go through all the details available. Because if you want a doctor or a physician to believe that this concept will work and can be a pivotal point in healthcare system, you have to be thorough, right? When they ask a question, you just cannot look into your book and start writing. Yeah, that is not going to happen. So research can help to dispel doctors' skepticism about the use of graphic stories. In doing so, doctors should ensure that the patients do not feel brushed off. Like a patient comes to you, ye lo, ye comic book hai, aap padho, aap samjho. Aisa nahi hota. All right. So the patient should also not feel brushed off when given a book about a disease or condition in a graphical pathograph. Recent publications have featured graphic stories as a topic of historical analysis and disability studies and as a method for combating illiteracy, but few empirical studies exist on the effect in medicine. All right. We do have studies stating the actual benefit of it, but the effect studies are a little bit few. Now, I have myself included some of the questions to consider. Okay, so there are like 4 questions you can consider if you are trying to dig up more on this particular topic. Does the use of graphic stories in medical education improve students' observational diagnostic skill? And does it affect empathy? The second question to consider would be, do patients like reading graphic pathographies and find them helpful? As we all know, not everyone is same, all right? So everyone has a different perception about the graphic. And can graphic pathographies enable patients to ask more informed questions or improve their understanding of diagnosis and prognosis? So if you have ever come across a lot of patients, I have worked as a hospital pharmacist, so we have every patient, all right, let's say a 10 patient you met in a day, not all of them will ask you questions, all right? All of them will just give you a prescription, you just dispense the medicine and they will take it home. They don't have particular questions. They will just ask, kab lena hai, kab nahi lena? Is there a side effect? Is there something else I should be doing too? All right. These all questions are very rare. Now, the fourth question to consider would be, does the use of graphic pathographies affect the doctor-patient relationship? Now, as I said, there is a non-profitable organization. It's a website, all right, Graphic Medicine is a site that explores the interaction between the medium of comics and the discourse of healthcare. They are a community of academics, healthcarers, authors, artists, and fans of comics and medicine. The site is maintained by editorial team under the direction of Graphic Medicine International Collective. So the screenshot which I have included is today's website. All right, so you can see Reproductive Freedom Comics, Drawing Us Together, which consists of public life and public health in contemporary comics. Now, everyone is aware of what is TED Talks Daily. All right, it is something which you can find in Spotify also. Okay, so this is a picture of Sam Hester. She is a comic artist who has included and created a TED Talk and even a comic strip based on her personal experience, her mother's illness. So we will see that also as an example. Now, this is a cover page of 2 books. One deals with the epileptic condition, and second one you can see deals with the Alzheimer's disease. It's a novel about Alzheimer's disease. So this is a comic which is created by Sam Hester. As I said, she's a comic creator within the healthcare graphic medicine. In short, literally drawing attention to the patient's need and goals with pictures to foster better and more accessible caretaking. Hester shares how illustrating small details of her mother's medical story as she struggled with mysterious symptoms alongside her Parkinson and dementia led to more empathy, understanding, communication, and peace of mind. So you have ever met patients who are suffering from Parkinson and dementia? Their actions are very, let's say it's very difficult to give an explanation for why, so as to why they are sitting at a workplace or the next moment they are standing in between pillars. All right, so it is very difficult to explain their behavior. So these all things can be a little bit odd when a person is trying to take care of the patient. All right, so this all things can be made aware with the help of comics graphics, which makes it a little bit easier to understand without the harsh reality of the particular disease. So that's the end of the topic, and this is the few reference which I have taken. If you have read the references, most of them are the books. All right, some of them are the website address, whereas most of them, like the 2nd, 4th, 5th, all right, and the 7th one, Bird Brain. It's a comics about mental health, all right, starring pigeons. So these are the references for it. So if you get time, you can always read it. It's no harm in reading a comic, all right. I think most of the people might be interested in reading a comic rather than reading dry pages of a book. So that's the end of the presentation. Does anyone have any doubt? You can always ask. I believe it's an afternoon time and few people, none of you have a doubt. Thank you everyone for patient listening.
Thank you, ma'am. It's a great privilege and honor to propose a vote of thanks for today's session. I extend my gratitude to our distinguished speaker, Ms. Nisha Kalayil ma'am, for her relevant address on role of graphic medicine in public health sector. Ma'am has focused on various examples of graphic medicine, how graphic medicine play a valuable role, what are the benefits of graphic medicines, using graphic stories in teaching and patient care. And ma'am has also explained that graphic medicine would help us to lead more empathy and understanding and communication. With this, now we would have a 5-minute break. After that, we would be continuing soon with another session. Please be on the meeting.